Right, guys, thank you so much for speaking to us on medicine in a nutshell. Now, you three are all obstetrics and gynecology or ONG trainees, is that right?
Correct.
Yeah. Or in America, it'd be OBGYN, I would suspect.
Or OB-GYN.
OB-GYN, right? So I wonder if you could tell me who you guys are, first of all. Starting with you.
I'm Roberta. I'm the equivalent of the 5th year trainee.
Okay.
Yeah, I'm James. I'm one of the ST3s in obstetrics and gynecology.
Hi, I'm Abby. I'm on the ST2s in obstetrics and gynecology.
Great. And what's good about obs and gynae then? Why are you guys doing it? And what do you do in your specific bits of training?
Well, yeah, I mean, we were just discussing this a little bit beforehand, but certainly it must be one of the most varied career choices one can go in.
You have a very good mixture between medicine and surgery.
Okay.
And if you can't choose between the two, then it's a very good compromise. And it sounds like a cliche, but it's not really. You really do both.
You've also got opportunities from quite early on in your training to get a lot of hands-on experience, which you might not get in other specialties.
Yeah.
Which is quite good.
And I think one of the interesting things about the variedness, although we go into it as quite a varied career, there's quite a lot of scope to sub-specialise if you wanted to.
Yeah.
And people come away with jobs as an obstetrician gynecologist, a pure gynecologist, a pure obstetrician, or one of the 4 subspecialities, which are urogynecology, infertility,
Gynecology, oncology, and maternal medicine.
and
Fetal
maternal medicine.
Fetal maternal medicine. Yeah.
Yeah. Fantastic.
And in each one, I guess, has got its own different niches. If you like to scan a lot, fetal medicine, would be a thing. And then those who are more surgically inclined, perhaps, might choose gynecology, oncology. But yeah.
But as a trainee, you'd go through all of those subspecialties, and then you can choose it later on.
Yeah.
Yes.
Okay. So, how many years is obs and gynae training then, and when do you actually get in?
So it is a run-through specialty, and that's one of the main benefits of it. Once you have your training number, then you don't have to sit any further interviews,
Okay.
as long as you pass your exams.
Okay.
And it's 7 years long. So the first 2 years, so ST1 and ST2, are your very, very junior years.
Okay.
And then you progress to a registrar level, and again as a registrar you
At
have
ST3.
at ST3.
And to get to ST3, though, you have to pass part 1 of
Yeah.
your MRCOG,
Okay.
which you can take at any time out of medical school.
Okay.
So
But you won't progress to ST3
Until you've done that
until
exam.
you've done
Until
the
you've
first
done-
exam.
Okay, yeah.
Yes. And then your registrar years are your junior registrar levels, ST3 and ST4, and then your more senior, up to ST5 I would say, and then your senior years of registrar, which is ST6 and ST7. In order to progress to ST6, you need to have completed your part 2 MRCOG and the part 3, which is the final.
So if I can take you guys back, so you're getting into obs and gynae after your foundation years,
Correct.
Yes, correct.
and so if I were a foundation year, okay, a mature one, okay, what would I need to have to be able to get to the interview and get into obs and gynae training?
You need to have shown an interest of some form during your foundation 1 and 2 years.
Okay.
Probably, but the application time for FI1 is around December time,
of your
isn't it?
F2 year.
So they do say that you don't have to have done obs and gynae in F1, F2. I certainly think it helps if you can get a job. For example, a common way of showing interest, and particularly if you don't have a job in F1, F2, is to contact the department and try and do an audit in obs and gynae. That would be an easy way to show interest, and certainly obs and gynae is one of the specialities which conducts numerous amounts of audits, so there are always audits going spare.
And even as a medical student, you can get involved in projects by contacting the educational consultants that usually run the course and the exam.
And in terms of the interviews are like just interviews, or do they have OSCE stations or procedural things?
So for our interviews, and I know that they're starting to change a little bit, but the interviews are actually going on this week, and I've had 3 parts of them. So a third of it has been communication skills.
Mhm.
So you'll be generally communicating either with an antenatal clinic situation with a pregnant lady, or in the delivery period, about various things. Themes before have been things like blood transfusions and
there's usually a hidden twist
a hidden twist
to them. So it's not usually, like Abby was alluding to, it's not just you've seen a woman postpartum with a very low haemoglobin, prescribe her some blood. It turns out that maybe she or family members are Jehovah's Witnesses, and you explore further into that.
Separating the sheep from the goats, as it were.
Perhaps, yes.
Okay, so that's the communication
That's
skill.
communication. And then there is usually a third of it is clinical element, be that prescribing, be it prioritisation station, or there's been sort of emergency situations or laparoscopic training stations. And then the last third is an interview scenario where a couple of people on the interview panel will be asking the questions.
And you might be asking questions.
I'm really sorry.
That's all right.
Based on the curriculum vitae, so.
Okay, so
before
like
you
a
go through the
portfolio station.
Yes, so before you go through the interview process, you would have submitted your application and supporting documents. And
This
they
year
will
they've
throw-
taken that out.
Have they?
Yeah.
All right. Okay.
It's just now a straightforward interview. I say straightforward, they ask you the same sort of things. Why do you want to do obs and gynae? Audit cycle.
So it's still
Achievements,
talking through what you've
describe
done.
good
Yeah.
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 It's
And
basic
what research,
basic.
publications and papers, is that an important part of being able to be successful at an interview, or not that necessary?
No, not necessary.
It's good if you have it, but it's
But not necessary.
You don't have to have it.
No, okay. So that's excellent. And then you get into becoming, you get into your specialty training, and you say the exams and so on. There's the exit exam is a part 2 MRCOG,
Part
is it?
3.
Part 3.
So from September they have split the what used to be just the part 2. So now part 2 is the written part of it, and then part 3 is the OSCE station.
Okay. Sorry, just going back to the interview second. Are these national interviews or are they regional?
They are
National
now.
as of this year.
National. So they're centralized interviews.
Yes.
Okay. What about fellowships? Do you guys do fellowships after you finish your training, or are you encouraged to do it in your final year of training?
You can choose when you want to do them. Most consultant would advise to sit the exam, so part 2 and part 3, and
Yes.
then go on to fellowships. But they are not mutually exclusive, so you can still do a fellowship and take a time out of program period and go for a fellowship. But equally, if you haven't done it during your training, you can do it post CCT.
But fellowships aren't a prerequisite
No.
for getting a job at the end of the day.
Okay. So it's not a big part of training like in certain surgical specialties necessarily.
Not necessarily.
Okay.
If you wanted to do subspecialty training, so one of the big 4 that I mentioned earlier, you would have to try and get yourself research exempt, which is 2 publications as first named author, and then that is a separate training program itself. And most people that go into, for example, gynecology, oncology, have got an MD probably,
Or a PhD.
or a PhD,
Yeah.
Right.
and some substantial research behind them.
Excellent. And you said you get a lot of hands-on stuff. Do you guys get to theatre from quite early in your training?
Very.
Very early.
Very early. Too early? No, not too
No,
early.
but it's good.
So in terms of theatre, it's not necessarily classical theatre that you may think of in general surgery, but it's more management of labour ward and labour ward theatre. So it's a very procedural heavy specialty from an early stage, because to become from an ST2 to an ST3, you have to be competent at performing straightforward forceps deliveries, von 2s and caesarean sections. So you can do a forceps in a labour room or in an operating theatre, depending on how likely you think the baby is to deliver. And so in that sense, you're not thrown in at the deep end, but certainly your exposure is high from an early stage.
Which
But
is
But you
good.
tend to
Which
be
is
very
good.
well supervised
Yeah.
throughout. So
reassuring the pregnant women.
no, it
out
is true.
there.
It is true. Come on.
Yeah, but they don't have the same expectations on you being competent at doing operative laparoscopic procedures at the same stage. So
Until you get at a more
More
senior
senior.
stage.
The first couple of years are very obstetric heavy, and then sort of as you're a junior registrar, you've developed your obstetric skills. That's when you develop more of your gynecology skills.
So that's quite interesting. Excellent. And what about jobs? when you guys get out there, the jobs out there?
There are tons of jobs out there. However, the majority of jobs will be obstetric heavy. So I think if you wanted to do purely obstetrics and no gynecology, there will always be a job for you.
But if you were more gynecology oriented, then be prepared to look for combined jobs. The purely gynecology jobs are more
Rare.
yeah.
And perhaps they're more promotion, well, not promotion, but a more senior consultant would drop their obstetric, who've been in the post for 10, 15 years, would drop their obstetrics to focus more on gynecology.
And that's happening especially in the large tertiary centres.
And is that mainly an on-call related thing? It's out of hours work, or is it
it
just
would be
interest?
also during working hours, just in general. This is a big tertiary centres and a couple of very senior consultants which used to have both obstetrics and gynecology related jobs. Now their jobs plans has changed and they do just obstetrics or just gynecology.
And would you guys message out there for young doctors? Good job, good field, bad field?
Good job.
It's a good job.
It's a good job.
It is intense.
I would not recommend to do it if you don't like or if you don't know whether you might like it or not. You need to be sure that you like it because it's highly demanding. It's highly demanding.
It's also highly rewarding as well.
It is. One of the good side of it, especially in obstetrics, whereas in other specialty you tend to deal with very sick patients or sick patients in general. With obstetrics, you have the side where you're looking after women that are most of the time are well. So you don't just see sickness, you also see
Health.
And also perhaps in a slightly self-gratifying way, your immediate intervention can result in good outcomes.
It is. And
Excellent.
Yeah.
So thank you very much, guys. That was very informative. And thank you again. Cheers.
you're welcome.
Thank you. Bye.